cortisol and the how this can affect their general health, and what are some of the strategies that we can apply to our day-to-day life to try to control those cortisol levels and stress in general. So hormones are a very important part of the functioning of our bodies. They have a huge role in maintaining a balance or homeostasis in pretty much every single thing that our body does, every process. It's gonna regulate different functions like metabolism, stress, which is one of the things that we're going to address today, growth in the case of children. We're going to talk a little bit specifically about cortisol, which is a very important hormone as well. Thinking of the way we think of hormones is they are messengers. They bring information to different organs in our body, and it tells the different organs or tissues what to do. The other important thing is about this is what are the things that are going to react to the different hormones. So today, specifically, cortisol. So cortisol is produced by the adrenal glands. The adrenal glands are located right on top of our kidneys. Very important glands. Cortisol, as you all know, is considered or is known as the stress hormone. And yes, that's true, but it's not only what it does. Cortisol regulates metabolism. It gives us energy. It lets us adapt to stress in general, regulates sugar, blood pressure, energy, immune system. Is very important for our body. Things like some electrolytes, sodium in particular, can be affected by our adrenal glands, and more specifically by cortisol that is produced by the adrenal glands. The other important thing is that cortisol has an effect on the pituitary gland. This is a gland that we have. It's located in our brain, right behind our eyes, in the center right here. And that produces different hormones as well. One of the hormones is called this one, ACTH. And there's a feedback there. The pituitary gland produces that and stimulates the adrenal gland to produce cortisol. So we have that circle here, and that is a constant thing that is happening in our bodies. If I produce too much cortisol or stress hormone, then my body is going to block the pituitary gland from producing all of the ACTH so that it stops the overstimulation of the adrenal gland. And that is a good thing because we keep things stable or in balance, but in some instances, it can lead to different diseases or conditions. I'm sorry, I don't know why this is not being changed here. I apologize for that. Having some technical difficulties here. Right. Okay, here we go. So what is the role in hormone regulation? So it interacts with other hormones. Insulin, most of us know what insulin is. It's produced by the pancreas. Glucagon is basically sugar that our liver produces, and that has an effect on the way that some systems work in our body. And adrenaline. Everyone has heard about adrenaline. You know, that's the hormone that can give us energy, but it's very important maintaining our blood pressures or heart rates, a lot of our mental capacity, concentration, etc. So it has all of these hormones that are very important. And again, we need balance, homeostasis. If any of these things are above or below normal levels, things are not going to go well for our bodies. So cortisol helps us, as I mentioned before, it helps us maintain energy. So when you're exercising, you do need cortisol, you do need adrenaline. Otherwise, the sugar would go down and the blood pressure would go very low as well, and that would cause us to pass out. And our body will not function the way it's supposed to. Some serious conditions that are very rare, fortunately, are the result of overproduction of cortisol. Cushing's disease is one of them, very rare. I've been a physician for a little bit over 20 years, and I've seen 2 cases of Cushing's disease. It's extremely rare. And there's another one that I didn't mention here that's called Addison's disease. That's when your adrenal gland is not producing enough cortisol. But again, these are extremely rare. I've never seen a case of Addison's disease. Then, what is the effect of cortisol in our blood sugar? So it directly stimulates the production of glucose in the liver. Remember that glucagon that I mentioned before? So that's the sugar that our liver produces. Our liver is constantly producing sugar, and that's important overnight, at any time, basically 24/7 through our entire lives. And that's a good thing. But in some cases, the glucose starts overproducing, or the liver, I'm sorry, starts overproducing this glucose. And that is when we start having other problems like diabetes or pre-diabetes. One of the core defects in diabetes and pre-diabetes is the excessive production of sugars from the liver. Cortisol also reduces the uptake, or the sugar will not go into this muscle and fat cells too rapidly. And that's also a good thing, because when we have too much of that glucose going to the fat cells, that's when we start storing energy, and that's when we gain weight. So that is a very important part of the cortisol. So it's not only about make us gain weight, but it has an important part in maintaining that balance. And as it was mentioned before, the energy during stress, which is also important. So how does it affect insulin? So since cortisol can increase blood sugar, there's going to be an interaction or counter effect between that sugar and insulin, and indirectly it's going to affect that cortisol. So things like chronic stress, chronic inactivity, things like that can increase cortisol levels. Generally, these are not very high levels when we check in the blood. And they may look normal or within ranges. Those very high increases or changes in the blood work are going to be associated with things like Cushing's disease or Addison's disease that I mentioned previously. So the liver starts producing a lot of sugar, and your body responds producing insulin. Your pancreas is the one involved in that, but over time you develop resistance. Basically, your body becomes immune to that insulin. Therefore, your body needs to produce more insulin. So more insulin means insulin resistance. Your body does not react to it the way it's supposed to. Insulin, that's the opposite of cortisol. It brings that glucose into the fat cells and the muscle. And the muscle, that's a good thing, but because you use it as energy or fuel. And the fat tissue is not necessarily a good thing. You need reserves, but if it's too much, if it's overbalanced, you gain weight. So dysregulation, things go off balance. So what's gonna happen? Chronic high cortisol. You have it for long enough, several months, actually years. It's gonna cause high sugars, hyperglycemia. Therefore, you're gonna have an increase in the risk of type 2 diabetes. Um, Low cortisol, on the other hand, as I mentioned before, that can cause low sugars. And there are some people that have these problems where they get sweaty, confused, dizzy, hungry. That means that your sugar is going down. But we have to document that. We can't just assume that because I feel like that, my sugar is low. It's important to see your doctor and try to document that you're having actual low sugars. That way you're not overeating sugary foods, and then that can turn into health problems in the long run. And again, fatigue and low energy. You're over producing this cortisol. The adrenal glands may respond not producing enough, and then the whole balance that we talked about previously is lost. So how do we manage cortisol levels? So stress management is easier said than done, right? So um, uh, many of us or the doctors, even my doctor says, oh, you need to manage your stress. Yeah, but how do I do this? How do I get my stress to get better? How do I get my insulin resistance to get better? Or how do I prevent it in the first place? So we really need to try to we need to be intentional about these things. Exercising, it's very important. Get moving. We don't need to run marathons. We don't need to go to the gym for 4 hours. 15 to 20 minutes of moderate pace to a rapid pace walking is enough. You don't need to run. Meditation, that can help you. A few minutes of quiet time for yourself, or me time, as they say, uh, is very important. Try to disconnect some people say, but I can't think about anything. And it's okay. It's just about being relaxed, breathing slowly, deeply. Eventually, you will learn to disconnect and avoid those thoughts. But if you're having those thoughts, it's not a problem. You're still meditating, you're still relaxing. And proper sleep. In our modern society, we have all of these things that we have to do, work for the next day, deal with our kids, family members, if we're the caregiver of either adults, older, or the elderly, or kids. That can be very stressful and lead to a lot of fatigue. So trying to sleep, at least 6 hours, six and a half hours a day, at night, if possible, is something that's going to be very important. There are some hormones that are produced in your sleep that can also stop the production of cortisol while you sleep. If you can sleep more than that, even better. Diet. So a balanced diet. We all talk about vegetables, heart healthy diet, things like white meats, things that are rich in omega-3. Those are going to be important. And avoiding excessive sugar intake in your diet. This can have a direct effect on insulin, as we mentioned before, that leads to insulin resistance. Cortisol is going to increase because it's going to try to reduce the effect of that insulin. So your sugar goes up, insulin goes up. It's a vicious cycle that never ends. So controlling that sugar in our diet is very important. Reducing caffeine. Caffeine can overstimulate the adrenal glands. It can increase your adrenaline. It can have an effect long-term on things like fatigue, anxiety, and all of those palpitations, rapid heartbeat. So some people think, oh, okay, if I drink coffee or caffeine, I'm gonna have energy all day. Actually, you're depending on it to maintain energy. If you reduce it over time, your adrenals are gonna um, become functional or gonna function the way they're supposed to, and you're gonna start feeling better as far as of that fatigue. Medical interventions when needed, very rare. There's not really a medication that we can use directly for this. Again, if we check this in the blood, they're going to be very insensitive. There are some tests that are done, like in saliva. They're not very well studied. They're still considered experimental. A lot of functional medicine doctors are doing this. But again, what do we do with these levels? And we're gonna tell you, okay, your cortisol levels are high. There's nothing really I can prescribe. The recommendation is going to be the same, exercise, meditation. We can give those recommendations without that test. Now, if we think that the cholesterol is going to be significantly high and we're suspecting one of the diseases that we mentioned before, that's a different story. You're going to see a significant increase or decrease in cortisol. Therefore, cortisol testing is not routinely recommended. Okay, so this basically concludes the talk that we had scheduled for today. I'm going to go ahead and address some of the questions that were sent to us in advance, and then we'll have some time for additional questions or comments regarding this topic. So the first one is, are there any correlations between cortisol and weight? And the answer is yes. Yes, as we mentioned during the presentation, this elevation in cortisol can lead to weight gain. Mostly the weight gain is going to happen in the midsection. So that persistent weight gain that happens around the belly, the waist, that's going to be a sign that is cortisol. It's stress related sometimes, not all the time, but that could be one of the factors leading to that. It's not going to be, a whole body weight gain. You're gonna gain some volume or fat volume around the arms and the legs, but you're gonna see that shape, that most of that fat gain is gonna be around the waist. Then another effect of cortisol that we didn't mention is the increase. So there's a physiologic way that it increases the weight, but also indirectly, it's gonna cause other problems like hunger. A lot of us say, "Oh, I stress eat. When I'm stressed out, I eat," and it's actually the effect of both cortisol and insulin that's going to increase our appetite. We're going to have cravings for sugary stuff, carbohydrates, starches in general, and sometimes even foods with high fat content. Next question. Do you have a lot of cortisol while on menopause? Menopause, not necessarily directly from a physiologic standpoint, but menopause itself, because of the effects and the symptoms that you can have, that can increase cortisol production. It's not necessarily produce or stimulate your adrenal gland to produce a lot of cortisol. So the change in your hormones after or during menopause is not going to do that directly. But again, the stress, the changes, the fluctuations in the ways you feel, you live your life, that's going to have an effect on cortisol. That's going to lead to potential sleep problems, insomnia, weight gain, fatigue, and that can be indirectly as well affected by the cortisol levels. Next question is, how much is too much caffeine? So generally, it's accepted that around 400 milligrams of caffeine per day is considered safe. It's not going to cause a lot of problems as far as of very, very fast heartbeats or palpitations, insomnia, even if you consume the caffeine during the day, even before 2 p.m., that can affect your sleep at night. There can be a long effect, although in theory, most of that caffeine should be out of your system within 6 hours or so. Exceeding this amount, as I mentioned, it can lead to insomnia, palpitations, anxiety, and it can stimulate the production of cortisol, particularly if combined with chronic stress. You know, you're tired all the time. Again, we have all this vicious cycle again. Stress that leads to, you know, fatigue. You don't sleep well, you feel fatigued, you drink a lot of caffeine, you end up stimulating your adrenals to produce more cortisol. That makes you more fatigued and so on. So breaking those cycles is going to be the way to go, the secret sauce, if you will. So try not to drink too much caffeine as much as you can. So 400 milligrams is about 4 cups of coffee. So every cup of coffee is going to contain anywhere between 100 to 120 milligrams. So that gives you an idea of how much you're consuming. Coke is going to contain about 40 to 50 milligrams, depending on what you consume. So be careful, even zero, from the sugar standpoint, we shouldn't be consuming that anyway. But you know, if you're consuming regular coffee plus sodas, that's gonna add up to the amount of caffeine that you're consuming. And there are other things like green tea, even regular tea is gonna contain some caffeine, and usually around the same 40 to 60 milligrams for every 8 ounces, depending on what you're drinking. Next question is, how do you know if your cortisol level is high? So as we mentioned before, the symptoms are going to be fatigue, difficulty sleeping, of course, weight gain, especially as I mentioned before in the midsection of the abdomen. It can cause mood changes. You're hungry all the time. You're tired all the time. That's going to affect the way that the day-to-day challenges, the way that you react to the day-to-day challenges. High blood pressure, also high sugar, insulin resistance. So all of those are going to be effects of this cortisol. Do you test for cortisol? Again, as I mentioned before, it's rarely indicated. There's not a huge clinical value of having a cortisol level because, again, there's not a specific medication that we can prescribe for that. It's a different story if you have a condition, like I mentioned before, which in those cases, then yes, we have medications to increase cortisol. Cortisol is a steroid, so generally we treat patients with those problems with steroids, and if it's too high, they remove the adrenal glands, which are the ones that cause the increase in cortisol. So testing in saliva and urine, that's still considered experimental, and the ones in blood, the ranges are so big that it's going to be very difficult to measure small variations in your cortisol levels. You won't see it on the blood work, but you will feel it. So there's really no value because you tested, and the doctor will tell you, oh, your numbers are normal, and you're going to think, oh, I'm making all this up. And no, cortisol, the effect of cortisol, even if it's within the normal ranges in your blood, it can still affect you for sure. So other things that are important is in these cases is metabolic panels. This cortisol problem, the fatigue in particular, can be confused with other issues like thyroid problems, like insulin resistance, like problems with your electrolytes, sodium, potassium, magnesium. So all of these things should be tested as well, and not necessarily the cortisol level. The next question I have is what would be substitutes for caffeine, Coke Zero, coffee, etc. And this is very specific, or any supplements for a 50-year-old woman. So so caffeine-free alternatives are always gonna be better for you in general, but there is nothing wrong with consuming up to 400 milligrams of caffeine a day. Coffee and caffeine has been associated with improved abilities to focus, improved memory, and there has been even some suggestions that it may reduce or delay the development of certain dementias. Again, that's not proven, but it has been suggested in the past. So unless you have specific reasons to avoid caffeine, um, there's really not a specific indication. Sometimes, in particular, women that drink a lot of coffee, they can develop a condition called fibrocystic breast disease. You have all these cysts and fibrous tissue in the breast tissue, and that can obscure and reduce the specificity or the effectivity of mammograms when trying to diagnose or find any abnormal tissue or tumors. But if you really must or you want to avoid caffeine for different reasons, there are some herbal teas, there are some other sources of energy. There's some mushroom. I can't remember the name at this time, but you can make teas with that, and it's not going to have the same effect. It's not going to be absorbed as quickly as regular coffee, so that caffeine is going to have a more steady effect on your body, so you're not going to have palpitations and feel anxious and that sort of thing. Then vitamin B12, that's something that has been recommended. That's debatable. If you have a deficiency, for sure, B12 is going to help you. If you have a balanced diet, really, we don't need any vitamins besides vitamin D. And the reason for that is because we may consume a good amount of vitamin D in our diet, but if we don't get enough exposure to the sun, your body is not going to transform that vitamin D2 that we consume in your diet into vitamin D3, which is the active form of vitamin D. And then there are some other ones that you all probably have heard of, like what's the name? Ashwagandha. That's one of the herbs that have help with energy, concentration, fatigue, but they have side effects. Many times we think, oh, it's natural. Ashwagandha can cause things like people can feel a little bit depressed, not necessarily fatigued. They'll have energy, but they won't feel emotion. They may feel pretty flat. So it doesn't happen to every person. Usually what I tell my patients with these supplements, try it. If you see a benefit and there are no side effects, continue using it. If you see that it doesn't do anything or it gives you side effects, then stop taking it. Don't spend money on that. And then some antioxidants, things like turmeric as well, has been associated with an increased energy and increased focusing. I have one more question. What to discuss with my doctor regarding cortisol and a family history of cancer. So cortisol, generally, since if you're under stress, as we learned before, it's going to increase your cortisol levels. This will affect your immune system. This can affect the way that your body reacts to the way that your cells should normally react or function. Our cells are in constant change. Some of them are just getting older, aging. Some of them die and new ones are born. So that happens in our bone marrow or blood cells. And sometimes is in different tissues, and that's where cancer comes from. The programmed cell death that our body is supposed to do is not happening. So many of the cells in our body are programmed to have a certain lifespan, and they're programmed to die. That doesn't mean we die, just the cells are dying and your body's producing new ones. When you stop producing, those cells stop dying, that's when cancer can happen. There's not necessarily a direct effect of cortisol on cancer. It's more of an indirect effect because of the association with stress, and things like diabetes can increase the risk for different cancers as well, particularly when it's not controlled. So just managing or checking the cortisol is not going to be enough. Remember to do all your screenings, um, colon cancer screening, breast cancer screening are the most common and accepted screening tests. Really, in general, these are the two cancers that have very accurate screening tools. And then in some extreme cases, genetic testing. Again, this is outside of cortisol. If you have a family member with certain cancer, they started with that, like colon cancer at an early age, have a colonoscopy before it's time to have a colonoscopy. Don't wait until the age of 45 to have one. If someone has breast cancer in your family, did they have a specific gene that is inherited? So their doctor or oncologist will be able to tell them about that. They should communicate to their daughters and even men. Even men can get breast cancer. So that's something that can be addressed with your primary care doctor as well. And I believe I had one more question, right?
We actually have several that are
Yes.
on here.
Oh, okay.
So one of them is, and I think some of this question you answered already, but what is the normal amount that a woman should have, and is there a test that can be performed to find out the levels? So I think some of that you may have already answered.
Yeah, so I mentioned before that the range is pretty wide, and those small, almost intangible changes in cortisol are not going to be effectively measured by a blood test. So that's why, unless there's high suspicion of one of the two diseases that I mentioned before, then we do a cortisol test. Otherwise, we're not be able to tell the person, oh yeah, your level is high, and we're this is the treatment that we're going to do. If you have the symptoms, weight gain, fatigue, sleeping problems, then what we have to do is we have to address or try those strategies that we mentioned for stress management.
Okay, and I think you answered the other part of her question too, which was, so if cortisol testing is not recommended, then how are the levels determined?
So it's a clinical diagnosis is what we call that. Clinical diagnosis is something that you don't need a test. There are signs and symptoms and findings on the physical exam that would lead to that. That's why cortisol testing is not routinely recommended.
Next question is, can you explain how vitamin D and fish oil influence cortisol levels, and which supplement would you recommend? Which is the most beneficial?
So both supplements can be beneficial. Fish oil, you can consume it in your diet. So things like salmon, avocados will contain good amounts of omega-3, or of course, consuming fish, sea bass, to a certain extent, tuna. There is not a direct effect necessarily on cortisol, but there's a direct effect on bone health. It can affect arthritis and things like that. And vitamin D can affect the strength of your bones. So think of vitamin D as cement. You need calcium to maintain the strength of your bones. So, but if you have all this calcium in your bloodstream, but there's nothing to bring it together, in this case, vitamin D, you're not going to have strong bones. And over time, that's going to increase the development of osteoporosis. Cortisol can lead to that as well. So high stress, high cortisol no exercise, a sedentary lifestyle, that's going to lead to osteoporosis. So at least the vitamin D will help you mitigate a little bit of that effect.
Okay, next question is, when you were talking about the caffeine, they asked how many ounces is that? Because you talked about 400 milliliters,
Milligrams.
milligrams.
Yeah, so it really depends. So it varies. In general, a cup of regular coffee is going to be around 100 to 120 milligrams. That's 8 ounces. Per most of the cups that we have at home, it's going to be eight ounces. Sometimes people have, a Yeti cup or something like that. That's going to be more in the 12 to 16 ounce. If you get your coffee from the uh, gas station or um, Starbucks or a place like that, it's going to depend on the size. So it's we cannot really tell in terms of ounces. Concentration is going to be different as well. So you may drink an espresso, which is a very small, 2 ounce drink, and it may contain the same 120 milligrams that a 12-ounce coffee from the convenience store may contain. So it's very difficult to just tell you in terms of ounces. In general, normal coffee is going to be 100 to 120, so 3 to 4 cups a day. That's going to be about 32 ounces a day, considering that concentration that I just mentioned.
The next one had to do with the mushroom that you were talking about. I think they were giving the name lion's mane.
Lion's mane, yes, thank you. So yes, so a lot of people have good results with that. And again, just like any other supplement, you will know exactly how it works until you try it. Now, always ask your doctors because some of these natural supplements may have interactions with medications that you are taking.
The next one asked, so lion's mane helps, and then they also said tea and how much tea.
So it depends on the amount, again, the concentration of caffeine in it. So you'll have to look at either the nutrition facts or sometimes in the ingredients, it will tell you. For example, uh, I have here a Coke Zero, and this one contains 30 milligrams of caffeine in 12 ounces. And that's just a regular can. So, that's some people, in my case, I don't consume a whole lot of caffeine. I may drink just half of that every so often. I don't drink coffee in general, but those, 15, 20 milligrams that I consume when I need it is generally enough for me. So it's really gonna depend. You have to look at the numbers. It may be very diluted. You are at ice, for example, to your tea. You put more water in it. You make it at home and you have a bag, 2 bags in 1 cup. That all of that is going to vary. So you have to know how many milligrams of caffeine there is in the particular product that you're going to consume.
I think this is the last one, but it was really more, I think of a statement that some of the testing that I think you were talking about, you can't do until you're 40, but I think you mentioned that if they've had family history, that they can get it done sooner.
That is correct. Yes, for colon cancer, 10 years sooner. We are seeing more colon cancer in younger people, and many of them have family history. So it's very important to know your family history. That way you can be more proactive about things like colon cancer.
So are there any more questions that are out there? You can also take yourself off of mute to ask the question, or you can post it back in the chat.
I believe there was one more question that was sent to me. It was, how do I become less insulin resistant, um, as I am under a lot of stress at home as a caregiver? So we mentioned before, how that can be very stressful for sure. I tell many of the caregivers or my patients, I tell them a tired and fatigued caregiver uh, is not going to be the best caregiver. And sometimes there are no options, they're the only ones. So you need me time. If you don't have help, you don't need 7 hours, a week. Just, 5 minutes of meditation, a 15-minute walk, that you can do even around your office or at work. Just some time to kind of disconnect. That's going to be something that will help. Deep breaths, on your way home, breathing slowly. You're driving, you're commuting. Breathe slowly, be intentional about it. Have some time to dedicate to social things, go go have a coffee. We've been talking about caffeine. Go drink a coffee with your friends, during lunchtime. Once a month, go out with some friends. Have a date night with your partner. All of these things, me time is very important. Now, addressing insulin resistance, it sounds easy, but it isn't. Sometimes doctors can tell you just exercise, just don't eat sugar. It's not that simple. It's a process. It takes time. It's not going to be a week of exercising and avoiding sugar that's going to fix the problem. You need consistent exercise. And again, you don't have to run marathons, 15, 20 minutes a day is going to be enough. The American Diabetes Association recommends about 150 minutes. So you can, if you have the time, an hour 3 times a week, half an hour 6 times a week, 20 minutes 7 times a week. So it really depends. And of course, the diet is going to lead you to weight loss, eating less carbohydrates. If you're not diabetic and you only have insulin resistance, you don't have to stop eating sugar or carbohydrates altogether. You just reduce the amount and eat more protein, eat more meats and egg whites and things like that.
So-
Any other questions from?
I think the last one was more just comments because we were talking about the screenings. They had mentioned that they had colon cancer at 41 and they did not have family history.
Yes, and that's another thing that we're finding as well, is and I think that eventually the recommendation for routine screening is going to go down. I've even had patients in their 30s. So any symptoms, any concern, talk to your doctor. You don't wait until, oh, I've been bleeding for 2 years now, and I thought that this was normal, or I was constipated. I thought it was normal. Consult with your doctor. Just make sure that even if you don't have family history, all of the things, the way that we live, the way that our modern society works, we don't eat the healthiest, we don't get enough exercise, we may not have the best habits, and again, the stress, immune system problems, all of this is gonna increase air pollution, water pollution. This will increase the risk for problems like cancer and different chronic diseases.
And they said advocate for yourself.
That is correct. Me first.
Are there any other questions? Okay, if there are no other questions, that will actually conclude our presentation for today. And I, again, greatly appreciate you guys attending.
Thank you very much. And have a Merry Christmas and a Happy New Year.